Your fasting glucose number this morning, was it where you hoped it would be? Or did you open that meter, see the number, and feel that familiar weight? The quiet exhaustion of someone who did everything right and still got it wrong? Here's what I need you to understand right now. That number may have almost nothing to do with what you ate last night. There is something happening inside your body after age 60, something most doctors never bring up in any appointment, that is quietly making your blood sugar harder to control, your insulin less effective, and your kidneys work harder than they were ever designed to. And the damage from it is building up silently, every single day. My name is Dr. Grace Wells. I'm a kidney and diabetes health educator, and I work specifically with adults in their 60s, 70s, and 80s. I see this pattern constantly. People who track every carb, never miss a medication, walk after every meal, do absolutely everything by the book, and still can't stabilize their numbers. If that sounds like your life, I need you to stay with me for this entire video, because what I'm about to explain can change the way your body handles blood sugar. And more importantly, it can protect your kidneys before the damage becomes something that can't be reversed. The link between your blood sugar and your kidney function is far deeper than most people are ever told. And at the center of that connection is water. Not whether you drink it, but when you drink it, how your body actually uses it after 60, and what goes wrong in your cells when you get it wrong. Let me start with what actually changes in your body as you get older, because this is where everything begins to make sense. When you were in your 40s, your body was remarkably forgiving. Skip water for half a day, drink coffee all morning, and your cells adapted. Your kidneys had enormous reserve. Your thirst mechanism was sharp and reliable. After 60, that forgiveness disappears. 4 specific changes happen in your body that most physicians never walk you through. The first involves something called aquaporins. These are the tiny protein channels in your cell walls. They're how water actually moves inside your cells, not just around them. After 60, these channels become less responsive. Even when you drink a full glass of water, your cells struggle to pull it in. You can be drinking regularly and your cells are still partially dehydrated. The second change is kidney function. By your late 60s, your kidneys have naturally lost 30% or more of their filtering power. They're less efficient at clearing excess glucose from your bloodstream. And here's the part that surprises most people. They're also less efficient at retaining water, so you lose more fluid through urination than you did decades ago. The third change is your thirst signal. Research shows that by age 65, your thirst response can lag 60 to 90 minutes behind your body's actual need for water. You can be clinically dehydrated and feel completely normal. No dry mouth, no headache, nothing at all. Your body's early warning system is simply no longer reliable. And the fourth change, this one catches almost everyone off guard. Many common medications for diabetes and blood pressure, especially diuretics, actively pull water out of your body. So not only is your natural hydration declining with age, your medications may be accelerating that loss at the same time. Now here is why all of this matters so profoundly for your blood sugar. When your cells are even 2 to 3% below optimal hydration, your cell membranes become rigid. Picture a fresh grape versus a raisin. The grape's skin is flexible, open, receptive. The raisin's skin is sealed and shrunken. Your cell membranes work exactly the same way. When they're properly hydrated, insulin receptors function normally. They open the door and let glucose move out of your blood and into your cells. When they're dehydrated, those receptors stop working properly. Your insulin, whether your body is producing it or you're injecting it, cannot do its job. Glucose stays trapped in your bloodstream. That is not a food failure. That is not a medication failure. That is cellular dehydration showing up as a high number on your meter. But here's what's happening at the same time that you need to hear clearly. When your blood becomes more concentrated from dehydration, your kidneys have to work significantly harder to filter it. Every hour you spend mildly dehydrated is an hour of extra strain on your kidneys. Over months and years, that strain accumulates. And by the time kidney damage shows up on your lab results, a meaningful amount of function is already gone. Permanently. This is why I want you to understand this now, not after your next set of labs comes back. Let me tell you about a patient I'll call Margaret. She was 71 years old when she first came to see me. Her nephrologist had flagged early kidney decline. Her eGFR had dropped from 68 to 54 over 2 years. Her creatinine was slowly climbing, and her blood sugar control was deteriorating at the same time. Her A1C had gone from 7.4 to 8.2 in that same period, despite 2 medication increases. When I sat down with Margaret, the signs were visible before she said a word. Dry lips, slightly dull skin. That particular kind of fatigue that goes deeper than sleep. Her urine, when I asked, was consistently dark yellow. I asked her to tell me everything she drank on a typical day. 2 cups of coffee in the morning, a glass of water with breakfast, afternoon tea, a glass of water with dinner. That was it. At her weight and age, Margaret's body needed close to 80 ounces of fluid daily. She was getting perhaps 24, and a significant portion of that was coffee and tea. Here's something most people genuinely don't know. Coffee and tea are mild diuretics. For every cup you drink, your body loses more fluid than it takes in. You're not filling your tank, you're draining it slowly while thinking you're helping. Margaret had been quietly dehydrated for years. Her kidneys and her blood sugar were both paying for it. We changed only one thing at first. Same food, same medications, same everything. We just restructured when and how she drank water. 10 days later, she sent me a message. Dr. Wells, my morning glucose has been under 143 days in a row. I haven't seen that in over a year. At 6 weeks, her energy was noticeably different. Her skin looked different. And at her 3-month lab recheck, her eGFR had stabilized and had actually improved slightly to 57. Her nephrologist described it as unexplained stabilization. I called it hydration. Before I walk you through exactly what we did, I want you to understand the 3 mistakes that most adults over 60 are making right now. Not because you've been careless, but because nobody ever told you this. Mistake number 1, treating all fluids as equal. Coffee, tea, juice, diet soda, these are not water equivalents. Coffee and tea act as diuretics. For every cup, your body loses more fluid than it gains. Juice, even unsweetened juice, causes blood sugar spikes that trigger your kidneys to dump both glucose and water simultaneously. And diet sodas? Artificial sweeteners have been consistently shown to worsen insulin sensitivity over time. The only thing that genuinely hydrates your cells is plain water. Everything else carries a cost. Think of it this way. Imagine you're trying to fill a bathtub with a slow leak in the drain. Coffee and tea don't just fail to fill it, they make the leak worse. Only plain water actually fills the tub. Mistake number 2, drinking cold water first thing in the morning. I know cold water feels refreshing, but here is what happens inside your body when ice-cold water hits your stomach early in the morning, before you've eaten, before your core temperature is fully elevated. Your blood vessels immediately constrict. This is your body's reflex response to temperature. It's trying to protect your core. But constricted blood vessels mean reduced circulation. And reduced circulation means insulin and glucose have a much harder time reaching your cells. Cold water on an empty stomach also triggers a mild stress response. Your body releases cortisol. And cortisol signals your liver to release stored glucose into your bloodstream. You've just created a blood sugar spike before a single bite of breakfast. Room temperature water, or even slightly warm water, keeps your blood vessels relaxed, your morning cortisol response calm, and your circulation optimal from the very first moment of your day. Mistake number 3, waiting until you're thirsty and then drinking a large amount at once. Remember what I said about your thirst mechanism. By 65, it's running 60 to 90 minutes behind your body's actual need. When you finally feel thirsty, you are already in a meaningful state of dehydration. And what do most people do? They drink 16 or 20 ounces quickly to catch up. Your intestines can only absorb approximately 8 ounces of water every 20 minutes. Anything beyond that bypasses your cells and goes directly to your bladder. You make an uncomfortable trip to the bathroom, and your cells are still dry. That is not hydration. That is the illusion of hydration. What actually works is small, steady amounts throughout the day. Think of it as the difference between slow, steady rainfall and a brief downpour. The rain that actually soaks into the ground is the one that falls gently and consistently, not the one that overwhelms the surface and runs off. Now let me teach you what I use with my patients. I call it the 4-window protocol. 4 specific windows of time during the day when you drink water in a way that directly supports both your blood sugar stability and your kidney health. Window 1. The moment you wake up, before coffee, before food, before your phone. Drink 10 to 12 ounces of room temperature water. Add a small pinch of mineral-rich salt or a few drops of a trace mineral supplement. You can find liquid trace minerals at any health food store for around $10, and they last for months. Why minerals? Your cells don't run on plain water alone. They need electrolytes, sodium, potassium, magnesium, to create the electrical gradients that allow glucose to enter. Water without minerals is like having a key but no keyhole. Nothing opens. After 7 or 8 hours of sleep without fluid, your blood has thickened overnight. It's more concentrated and harder to circulate. This first window rehydrates your blood, improves circulation, and primes your insulin receptors before your day begins. In my patients, this single step alone often drops morning fasting glucose by 20 to 30 points within 2 weeks. Not from a new medication, just from 12 ounces of water at the right moment. Window 2, 30 minutes before each meal, drink 8 ounces of room temperature water exactly 30 minutes before breakfast, lunch, and dinner, not 5 minutes before, not as you sit down, 30 minutes. This gives your digestive system time to activate and prepare. But most importantly for blood sugar, it slows the rate at which food moves from your stomach into your small intestine. Slower gastric emptying means carbohydrates are absorbed more gradually. Your available insulin can actually keep pace with incoming glucose instead of being overwhelmed all at once. Research consistently shows that this timing can reduce post-meal glucose spikes significantly. In some studies, the reduction is comparable to a low-dose oral medication. From water, at the right time. Window 3, mid-morning and mid-afternoon. Between meals, many people notice their blood sugar rising even when they haven't eaten anything. You check it and it's gone up 20 or 25 points since breakfast. No food, no obvious reason. What's actually happening is blood concentration. As your body uses water through normal metabolic activity, your blood becomes slightly more concentrated. More concentrated blood reads as higher glucose on your meter, even though no new glucose has entered your system. Drink 6 to 8 ounces around 10:30 in the morning and again around 3:30 in the afternoon. These 2 small windows prevent that concentration effect. Your numbers stay more stable, more predictable throughout the entire day. Window 4, 2 to 3 hours before bed. This one surprises people because the common advice is to avoid water before sleep to prevent nighttime bathroom trips. And that's partly right. Drinking at 10 p.m. and going to bed at 10:30 is a problem. But drinking at 7 or 8 p.m., 2 to 3 hours before you sleep, is entirely different. Your body has time to process and distribute that water fully. You'll likely use the bathroom once before bed and sleep through the night. Why does this evening window matter so much? It prevents your blood from thickening excessively during sleep. When you wake up, your circulation is better, your insulin receptors are more responsive, your fasting glucose is more stable. And critically for your kidneys, they work more gently overnight when they're filtering blood that isn't overly concentrated. I want to be honest with you about what the first week looks like. Because if I'm not, you'll stop before anything changes, you will use the bathroom more than usual, it is temporarily disruptive, I will not pretend otherwise. But here's what's actually happening. Your body has been in water conservation mode, possibly for years. Your kidneys have been working in drought conditions. Your bladder has adapted to living with less. When you begin giving your body consistent, adequate water, it takes time to recalibrate. By day 10 or 11, the vast majority of my patients find that bathroom frequency has normalized dramatically. Their body has learned that water is reliably available. It stops treating every drop like it's scarce. Week 2, blood sugar readings begin showing more consistency, not necessarily lower every single day yet, but less wild variation. The range between your highest and lowest reading each day starts narrowing. You can begin to see patterns instead of chaos. Week 3. This is usually when I start getting the messages. Morning fasting glucose begins falling noticeably, 15, 20, sometimes 30 points lower than the previous average. Post-meal spikes become less dramatic, and beyond the numbers, people describe something they weren't expecting. Mental clarity comes back. Afternoon energy improves. Some patients tell me that joint discomfort decreases because systemic inflammation drops when the body is no longer operating in chronic fluid scarcity. By week 4 and beyond, kidney stress markers on labs often begin reflecting what's changed. Your kidneys are filtering gentler, more dilute blood. They're under less constant strain. The slow erosion of function that was happening quietly begins to pause. I had a patient I'll call Gerald. He was 74 years old, had managed diabetes for 11 years, and had early kidney decline flagged at his last physical. His nephrologist was watching closely. His A1C was 8.6 and insulin was being discussed. Gerald was a quiet man. He sat across from me, listened carefully, asked almost nothing, and then went home and did exactly what we agreed on. No shortcuts. 4 weeks later, he came back for a follow-up and slid his glucose log across the desk without saying a word. He just pointed. His average fasting glucose had dropped from 174 to 128 over 3 weeks. At his 3-month labs, his eGFR had not declined further. His A1C had come down to 7.8. His nephrologist postponed the insulin conversation indefinitely. Gerald looked at me and said, very simply, "I've been taking medication for 11 years. Nobody ever mentioned water." That is the most common thing I hear. A few important cautions before I let you go, because you need to hear these. This protocol will not replace your medications. Do not adjust or stop anything your doctor has prescribed without their direct guidance. What we're doing here is optimizing the environment your medications work in, so they can work the way they were designed to. If you have congestive heart failure, significant fluid retention, and stage kidney disease or are on dialysis, please speak with your physician before increasing your fluid intake. These are conditions where fluid balance requires careful, individualized management. If you're on diuretics for blood pressure or heart conditions, improved hydration can naturally lower blood pressure. That's a good thing. But your current diuretic dose may eventually need adjustment as a result. Your doctor needs to be part of that conversation. And watch for signs of overhydration, though it's uncommon. If your urine is consistently completely clear more than 8 to 10 times daily, or if you develop headache or nausea, simply reduce your intake slightly. If you've been watching this and quietly thinking, "This sounds like exactly what I've been going through," you're probably right. The majority of adults over 60 that I work with are chronically underhydrated. Not dramatically, Not obviously, just quietly, consistently, not enough. And that quiet deficit is costing them blood sugar control they can't reclaim with more medication. It's costing them kidney function they can't fully recover. You can start the 4-window protocol tomorrow morning. The first window is simple. Room temperature water when you wake up, trace minerals if you have them, plain water if you don't. That is where it begins. If something in this video felt true for you, I genuinely want to hear about it. Drop your current morning fasting numbers in the comments. Tell me how much water you're actually drinking each day. I read every single one, and I respond to as many as I can. And if you know someone managing diabetes who's been doing everything right and still can't get their numbers stable, please share this video with them. Not as a promise, but because they deserve to know that the missing piece might be something this fundamental. I'll be back next week with more on protecting kidney function while managing diabetes after 60, because these two systems are far more connected than most people are ever told, and you deserve to understand both. I'm Dr. Grace Wells. Take good care of yourself.